Hi, my name is David Mahan. The topic of this presentation is the health and healthcare needs of migrant farm workers. I chose this topic because I feel this special population is oftentimes forgotten about or overlooked in today's society. In this presentation, I'll cover the general health attributes of this population, how these attributes translate into healthcare needs, and how we can address the specific healthcare needs of this population. So, let us begin with the common types of injuries this population faces. Migrant farm workers are employed in a field that has a high risk factor for occupational injuries. Occupational injuries that are common to migrant farm workers would include injuries from mechanical processors, injuries from vehicles, and injuries from crops. An example of an injury from crops would be a farm worker who could be crushed by stored grain. The types of injuries that come from this occupation would include cuts, burns, crushing injuries, degloving injuries, and other various types of trauma. Working as a farm worker exposes migrants to various types of injuries, but this population is also affected by various types of infectious disease and environmental hazard. Infectious diseases in migrant farm workers oftentimes stem from their country of origin. Migrants from developing countries are at a high risk for intestinal parasites, and without treatment, this can become worse and lead to other comorbidities. Furthermore, infectious diseases such as tuberculosis can spread through migrant farm worker communities when not treated or contained. On top of infectious diseases, migrant farm workers are susceptible to diseases from environmental hazards. Common environmental hazards would include animal manure, chemical fertilizers, and pesticides. Exposure to these hazards can lead to infections, neurological damage, skin damage, and a host of other conditions. Migrant farm workers are exposed to many different forms of acute diseases, but they also encounter particular chronic diseases. Migrant farm workers, as a population, are at a high risk for a variety of different chronic diseases. The most common chronic conditions experienced by this population are being overweight and being obese. Classification as overweight would be a body mass index above 25, whereas classification of being obese is a body mass index above 30. These conditions are important because they lead to other chronic conditions such as hypercholesteremia, hypertension, type 2 diabetes, and much more. These can lead to serious heart conditions and neuropathies, which can lead to early death or disability. On top of the discussed conditions, migrant farm workers are susceptible to other conditions as outlined in the chart pictured from Villarreal et al. Now that we have discussed the specific health attributes of the migrant farm worker population, it is important we understand the type of health care this population needs. Considering that migrant farm workers are at a high risk for traumatic occupational injuries, this population has a high demand for trauma care. Trauma care includes facilities that are prepared to adequately address a wide range of traumatic injuries, and it also includes the infrastructure necessary to respond to and transport patients from remote areas in a timely manner. Migrant farm worker communities also have a high demand for public health interventions. With a large portion of this population having a high risk factor for infectious diseases, public health interventions are needed in order to stop the spread of diseases throughout families. While these two types of health care are definitely important, migrant farm worker communities also need access to primary care. Primary care is a definite health care need in migrant farm worker communities. As it is currently, this population lacks consistent access to primary care resources. This is particularly detrimental because a lack of consistent access to primary care can lead to many of the chronic conditions experienced by this population. As discussed earlier, this population has a high risk factor for chronic diseases that affect multiple different body systems and can lead to early death or disability. Primary care can help manage and treat these conditions to keep them from progressing to death or disability. Also, primary care can help educate people on how to avoid obtaining these conditions. Now that we have discussed the needs of this population, we must examine the limitations to accessing healthcare resources that this population faces. Healthcare resources for migrant farm workers are limited. Rural areas tend to have a limited amount of hospitals and health clinics. This severely limits this population's access to emergency, surgical, primary care, and long-term patient care. On top of having a limited number of places that provide healthcare, rural areas oftentimes lack specialty care. This limits the types of care this population can receive. While resources are limited from an infrastructural standpoint, there are also individual limitations to accessing healthcare resources. In rural areas, transportation to and from health centers is a limitation. Resources are spread out over a large amount of area, and public transportation is limited. Another personal limitation is financial costs. Healthcare is very expensive. Most agricultural jobs aren't the highest paying jobs. While these limitations are certainly a negative thing, there are plans to better healthcare for migrant farm workers in rural areas. One way to fix the limitations previously discussed is by increasing the number of advanced providers in rural areas. Advanced providers, such as physician assistants and advanced registered nurse practitioners, can do many of the things that physicians can do, and sometimes do them at a lesser price. By encouraging more advanced providers to practice in rural areas, we can increase the accessibility and number of healthcare options for migrant farm workers. Furthermore, advanced providers can provide specialty care, which may be lacking in these rural areas. Another fix would be the implementation of primary health centers, one such as pictured above. Primary health centers are a physical location for physicians and advanced providers to provide care to rural communities. Government funding could help reduce the cost of the care provided or make it free. Hopefully, our country can find a way to implement these plans and a way to improve healthcare for migrant farm workers. Thank you for listening to this presentation. Here's a discussion question for further thought. Also provided is the bibliography.